Stream up and running. Good evening. It's good to see everybody again. I got my full studio equipment back. Thank goodness construction's done and we are ready to whip it on tonight. As usual, I'm still your same host, Mark Archabot, the Silver Fox, United States Marine Corps retired. Before we get started with my amazing guest on the other side, I would just ask that you continue to please like, share, subscribe, do all things, to get the message out of the podcast. I'd appreciate it. Thus far, we've raised over $3,100 for the Amphibious Tractor Memorial. We're going to keep on donating every single penny to that effort to get this mission done. So it's my honor to do it, and I appreciate all your support thus far, and thank you so much. We're going to get right into it. Doctors making a difference tonight. On the other side, I got my good friend over there, Mr. Dr. Eugene Lipov, who's an anesthesiologist, and he has come up with a cutting-edge solution to treat PTS rather than just throwing, drugs at people and pills. He's actually got a method out there that's really helped a lot of veterans and a lot of people out there with their trauma. I'm going to let him talk all about it. I'm going to let him talk about his background because he is a hell of a lot more skilled and educated in this than me. But everybody, please welcome my good friend, Dr. Eugene Lipov on the other side. Hello, sir.
Thank you so much, Akari. What a lovely, warm welcome. Well,
thank you.
Thank you. So let me just tell you who I am, why, and how I got here. And
please,
what can you do? What can be done to help people with PTS? Or my term that I like is PTSI. We'll talk about that in a second also. I was born in Ukraine, and I was educated in the United States. And I went to medical school, Northwestern. My father was a flyer during World War II. Out of his squadron of 10,000 people, 100 people made it home. So he was in pretty bad condition, and he got PTSD from that. So he passed that PTSD on to my mother. That's called secondary PTSD. So it turns out you can actually catch PTS or PTSD from somebody. And unfortunately, my mother took her life when I was an intern. And then from there, I went on to become an anesthesiologist and a pain doctor. And through interesting set of circumstance, I was able to figure out that a procedure has been done since 1925 called Stellate Ganglion Block, or SGB, seems to take away PTSD or PTS symptoms in about 5-10 minutes.
Okay.
And what it does, it seems to reverse a lot of trauma effects. So when somebody has severe emotional trauma, there is a change in the brain that is actually measurable. You can actually see it in a specific scanner. So when somebody says PTS or PTSD is an invisible wound, it's invisible if you have the wrong scanner. If you have the right scanner, you can actually see it, which is really cool. So, and fight and flight system gets turned on and it continues to stay on. So when somebody has that, they're miserable, like my father and like many veterans and many active duty personnel. Actually, the most common group that has the highest level of PTS is abused women, which is 1 out of 3 women in the United States are attacked sexually, and half of them will develop PTSD. So it's 1 out of 6 of 150 million people. So it's significant numbers. And what we found is when we do this type of injection, the PTSD or PTS symptoms such as sleep disorder, such as anxiety, depression, hypervigilance can all melt away. And we've certainly applied it to a number of military personnel, both active duty and not. I've treated a lot of special forces. So far, I think between 5,000 to 10,000 SOF guys been treated with this, not just by myself, military hospitals and other people. So that's kind of my claim to fame, kind of opening up a new little window in medicine, which is, I consider myself very fortunate to do that. I'm also trying to change the name PTSD, post-traumatic stress disorder, to PTSI, post-traumatic stress injury.
Injury, yes.
And in a very formal way. So I did a study in 2023, and we asked about 3,000 people, half were military, half were not. If we change the name, would you then seek care? Would it take away the stigma? And most people said yes, it definitely will help me seek care. So the term PTSI, post-traumatic stress injury, was developed by Dr. Frank Ogberg, who's a very famous psychiatrist, who came up with the term Stockholm Syndrome. And then he and Pete Shirelli, I don't know if you heard his name, he's a 4-star Army general. In 2013, his job was to reduce suicides for the US Army. So Frank and Pete went to APA, American Psychiatry Association, and said, please change the name. And they said no. So I've been trying to do that. Frank now is 87, so he passed that hot potato on to me. So what I'm trying to do is have the formal designation changed. So if people want to help with that, I have a website set up. It's called itsptsi.com. I'm trying to get as many people to fill out the survey to actually change that. When I went to the APA, they said, you haven't done enough. You don't have enough information. 3,000 people is not enough for them. I'm trying to hit 100,000.
Sure.
But equally, when I talk to them, in order to change the name, what you need to do is you need to demonstrate that the current name is causing harm. So, for example, there is a term that was called learning disability. They changed it to learning differences because it was causing harm. So I tried to use the same logic, and they go, yeah, but we don't want to change it. So that was not very good.
Yeah. Man, that's a lot to unpack in the last couple minutes that you're speaking. So first off, my condolences to
Thank you.
for you. Unfortunately, losing your mom, for the passing on of PTS is very, very difficult, and I can certainly understand your passion behind you creating solutions out there rather than just again, like at the beginning, just throwing pills at it, or just trying to talk your way through it, actually providing something tangible. Now, here's the thing that probably, I'm not speaking for everybody, but I know there's some people out there like, what do you mean injection and stuff, like, oh my God. And people who aren't familiar with anatomy, talk a little bit about exactly the injection, where it goes, and like the rate of, like return on investment, if that makes sense, like the amount of positivity on the receiving end. Floor is yours, sir.
I think you're asking success rate. So let's start with that. So success rate, 75 to 80% success rate, which is pretty high if you think about it, 10, 15 minutes. The other thing that's good about it, you don't have to wait a long time to have a response. It's almost immediate, 5 to 10 minutes. So I think that part is impressive, and it's very meaningful. As far as how it's done, we have a patient, first of all, if people want to be sedated, we can do that. But if people had epidurals or injections for pain, I'm one of those kind of guys who do those procedures. In this case, the patient lies on their back. They turn the head to the side, we clean off the neck, we use ultrasound to see what's in there, and we put the needle in a specific target. And the idea is to numb up a fight and flight nerves in the neck. It's called the ganglion. So the medication we inject is called bupivacaine. That's a drug that's used for pregnant women for epidurals. So it's safe. It's been around since the 70s. The procedure has been around since 1925. So when I gave testimony in front of Congress in 2010, my point was there's a lot of new approaches, new drugs, new this, This will not grow your tail. This has been around a long time. You understand it. And in good hands, it's a very safe procedure.
Yep. That's good. And I was going to actually mention that at the beginning. I neglected to that, that you have been, in front of Congress. You've done numerous, journal studies, numerous medical studies to make sure that this is indeed safe. But I got to ask, just for the people out there who are like,
Sure.
probably like, hey, maybe I want to try this and maybe it's different. Has there been any faulty procedures, any type of, negative reactions, anything like that, please?
Yeah, of course. Well, it depends with who, right? I mean, it's been done since 1925, as I said. So before we did them blind, meaning we would just palpate and stick a needle there. Then we got X-ray, and now we have ultrasound. The chance of having a significant problem is very low, but there's always, you're still piercing the skin.
Of course.
So there's only one big study that was done in 1992 in Germany. In the country of Germany, they did 45,000 stellates. They had 15 seizures because the needle went in the blood vessel, 9 pneumothorax because they were too low in the neck, and they had 2 allergic reactions. So out of 45,000, that's a pretty low number. But nowadays, it's markedly lower because of ultrasound. We can see where we're going.
Yeah, it makes perfect sense. And then I think the other thing I wanted to ask you, Doctor, I know that this is something that, that you specialize in and you can do, at your clinic and things, but is this kind of like a across the United States, or is this more specialized by certain, segments and fragments throughout the US? Is this like a procedure that can be done anywhere, or does it more just like a few guys like you who are doing it?
No, well, so Stellate Ganglion Block is done by pain physicians. So whenever there is somebody who was trained, who did pain fellowship, they were trained to do this procedure. A lot of them will not do it for PTSD because it's still relatively new, even though the first publication was 18 years ago by me. But people are still arguing about it. Now, I'm a chief medical officer for Stellate Center. We have 24 sites across the United States. We have one site in Israel, and we have 3 in Australia. But there are other groups who are doing this procedure. It's not just us.
Okay. Understood. I asked that because, obviously our viewers are spread out all throughout the world and, and different folks. And what I want them to do is, to listen to your words that, that it's safe. There's always, those
Yeah,
outliers where, things happen. I mean, shoot, you can get it from just getting a regular shot. You can get allergic reaction. But if they are indeed
sure.
really hurting, from their injury, from the PTS injury, I'd rather
Thank
have
you.
them.
PTSI.
Yeah, I'd rather have them, contact somebody like you than rather turn to, different measures that are more harmful, if that makes sense. So
Well, I
I
agree with
want
you.
to,
The other thing is, let me give you an example of one case, and I think it kind of exemplifies the whole story.
sure.
We can talk about military and non-military, but this particular one kind of tells you how it can look. So this gentleman, the way he described his job, he was in Australia. He was a policeman there. He said his job was to pick up dead bodies from tunnels. So he was a policeman. For 5 years, he was under care of the psychiatrist who gave him every drug known to mankind, and he was also a therapist. So he couldn't make any progress. 5 years, right? So he had a stellate ganglion block, and 2 weeks later, he had marked improvement. He started to come off the drugs. He became non-suicidal. He could sleep, all of that. And the therapy was much more useful because he wasn't shutting down and getting angry.
Sure.
So that's the kind of results we get to see, which is really pretty encouraging. So I'm not saying everybody needs this type of procedure, but if somebody has a lot of hypervigilance, they can't sleep, they've tried other modalities, it hasn't worked, I think it's time to think about something different. And if you think about the current therapeutic efficacy all completely, it's quite low. If you looked at Colonel Hogue, who's a psychiatrist at Walter Reed, he said current therapeutics, which is psychotherapy and drugs, are only 40% effective. That's a
Yeah.
problem.
Yeah. And here you are returning them, an 80%, double that, which
Big
is
difference.
really
Exactly.
remarkable.
Part of the thing here is compliance is very high. If somebody comes in, they have an injection, you're done. It's not a long under. You don't have to keep taking the
Right.
drug over an extended period of time, and the drugs can make you sick. Like a lot of there is a group of drug called atypical antipsychotics, like resveratrol. If you take that drug non-regularly, so you skip doses and all that, the chance of suicide triples. That's a
Yeah.
problem. That's
Yes.
not good.
No, it's a big problem, and by no means do I consider myself an expert on suicide, but I'm probably more familiar than most people because I'm very passionate about the topic. That coming off a two-front war of almost 20 years, the
Yeah,
the little 20 to 22 a day is more realistically probably almost double that.
yeah.
Um, last
So
month,
there was a.
yeah,
I'm
last
sorry.
month
Go ahead.
three. No, it's okay. Last month, there's 3 service members I served with that took their own life, and I'm just trying to. I'm so glad that Tyler Gray connected you and I because we're just trying to present information, to
Right.
people as
Yeah.
alternatives to that, extreme, or alternatives, to just walking around like a zombie, and just not being, living, your best life. So go ahead, doctor.
Exactly. Well, the other thing, keep in mind, there was a publication I think last month. They said that every 11 minutes somebody takes their life in the United States. You're looking at 320 people per day killing themselves.
Yeah.
I saw a publication, there's some argument about it, that actually the suicide rate in military is actually 46 per day, not 24.
Yeah.
I
Yeah.
mean,
We're close.
whatever it is, it's one is too many.
It's too much.
40 is horrific per day. If you think about it, per day, that's a massive problem. And regardless of what you could say, the current therapeutics, whatever is being done, is not working.
Right.
Right. So whatever is done, it doesn't really matter what it is, but the efficacy, we need to do something different. So the VA is looking into stellate ganglion block. They're doing quite slowly.
Sure.
DOD is doing some of that, but not, I don't think at the scale it should be, because the problem is so large. And the other things people forget is the spouses. Like, I'm very big, passionate
Yes.
about secondary PTSD. And when somebody goes to war, the whole family goes to war.
No
So you
doubt.
need to not forget the family. Sometimes we treat, like we've treated some special forces from Canada, we treated the guys, the women, and their kids.
Yeah. No, you're spot on about that. Me and my friend were talking about that a few months ago, about how a family might even have it worse than us that are forward, deployed, battling with
Well,
the
you
enemy.
have your group you're with, and you have a project. They're
Yeah.
trying to keep all the pieces together, and they're
Sure.
worried about every moment they can get a phone call. Oh, guess what happened?
No, it's an important point, to all the veterans out here, who tune into the podcast, please keep a good eye on that, and let's not discount, the families, trauma as well.
No, absolutely. They need to be respected and helped. The other thing is, think about what PTSD does that people don't think about. So one, I wrote a chapter on sexual dysfunction. Turns out 85% of guys with PTSD will have sexual dysfunction. Does not help the family structure.
No,
So
that's a
the block
problem.
seems to help that. I wrote a page, like I said, wrote a chapter on that. Also, the chance of heart attack if somebody has PTSD is twice as high compared to if you don't have PTSD. So it increases the chance of that. It also increases biological aging. All of that PTSD does. So people think, well, mental condition, no big deal. You can snap out of it. You can also pass it down 2-3 generations to your family. So it's really important to take care of it. Take care of it as soon as you can. Besides the suicides, we're talking about other risks, heart attacks, cancers, faster aging, all of that. That's all a problem.
Yeah, big problem. I think we did the intended thing of what I wanted to do tonight, which was, have you talk more detailed about it, about the risk, and that way we can put maybe some of the skeptics, to bay a little bit, and maybe create some curiosity out there, amongst the
That'd be
community.
perfect.
Yeah, and that was my main intention, tonight. And again, I've had a couple of folks that that are in my network that have done this with you, that have had tremendous success, and they're really, really
I love
pleased
that.
with it.
Yay. I love that.
Yeah, and my thing is just, I just wanted to, before we turn to your book, and I want to make sure we do a good pitch for that.
Thank
I
you.
just want our folks out there just to not suffer. That's all.
So if
And
I may,
just be
so here be
curious.
the message. Here be a message to your network. Don't lose hope, because people who have hope will not kill themselves.
Right.
There is other modalities available. If it's
Sure.
not stellate, think about ketamine. If it's not ketamine, think about TMS. Try something different. It doesn't always have to be the pills and psychiatric intervention. If it hasn't done for you, do not give up as a point. Do not lose hope. That hope is
Absolutely.
huge.
It's
Huge.
it's yeah, it matters, man. It's very important, man, to have some hope out there. So I agree with you, doctor. You've done now, instead of, just verbalizing, and just doing the, your anesthesiologist duties, your pain doctor duties, and all the other things that you're doing with the injections and helping out the veteran community. You took some time to write, about 264 pages, a good solid deep dive into trauma, into PTSI, and then into, just the whole topic. And it's called The God Shot. That's the name of your book. I want you to go ahead and tell everybody about your book and how they can get it. The floor is yours, sir.
Thank you. Well, let me tell you where the title came from. I'm very proud of the title. So I took care of a Marine years ago, and he said one of his buddies had a stellate ganglion block done by somebody else. And then that changed his life. So he said, I just had the gut shot. So when the guy came in and he said, I had a gut shot, I thought, that's an amazing name. Because, and the reason he called it's not because the doctor was a god or anything like that. It was because it changed lives. So if
Yeah.
you think about God can change people's lives, that was your thinking. So that's where the title came from. So the book is actually hopefully a book of hope. I'm very big into hope. You can probably read that between the lines somewhere.
Yeah.
Um, and I think basically it talks, there is only one chapter about kind of my history, how I got there, my traumas, blah, blah, blah. But we also talk about like secondary PTSD. And then we talk about which psychedelics are good, which not so good, at least from my perspective. What does trauma actually do to your body? Epigenetics, how does your DNA change with that? What can you do about it? What kind of care can you expect? What can you do? Things like that. So it's meant to be, it's science-y. It's certainly not a boring science book. I'm writing one of those for doctors, but that's a
Yeah.
totally different story.
Right.
Right. And the writer who actually wrote, I'm not particularly great writer. As Lauren, she's an amazing writer. And she's done, I think, a beautiful job looking at, we looked at the history, even this, it moves very fast. And, my wife is could be a pretty harsh critic of something that's bad. And my previous book was like, nah, that's not really, she really liked this book.
Yeah.
So I totally agree with her. And
Happy wife,
I
happy
think
life.
exactly, yeah, I call her Commander in Cheese.
I love it. I love that. That's amazing.
So the book is not out yet. You can pre-order it if you go to
Okay.
the godshotbook.com. You can pre-order it there. There's no audiobook yet. It will be coming out. I'm also, by the way, on a side note, I'll be on TEDx Mexico, San Miguel, talking about PTSI in January 15th.
Wow. Oh, good for you.
So I'm really trying to spread this message. I think it's really important. And, it's funny. I mean, people think, well, so my message there is one letter can save a life. I actually wrote a short song about it, it's 30 seconds. But can you imagine a single letter can actually save lives? That's such a simple concept. And yet we're not doing it. I think we should do everything we can to prevent suicide. It doesn't cost anything.
No.
There's no drugs involved. Nobody's going to make money off of this. Just get people better perspective.
Yeah, absolutely. And we've had a bunch of people pop into the live chat. I appreciate that, everybody in the chat. Yeah, I put up, Dr. Lipov's website, so that way you can access more information. In addition to, it's also got the pre-order for the book on there and everything else, and we'll put that in the description. I am grateful to have met you and to have collaborated with you tonight, because I just wanted to say from me to you, and on behalf of likely many more, that we appreciate you being passionate about this topic, finding solutions and actually sharing. And a lot of times people, I think they get skeptical, when they hear books and this stuff. But to me, it's like a labor of love, not a money making routine. I'm sure
No.
it's a labor of love. It's a way to give back, to us.
Well, I think the more you understand, so there's so much misinformation out there. I mean, right now, if you go on web, you can buy this herb that supposedly was grown under a special tree and it'll take everything away.
Yeah, right.
Well, maybe I would bet against it. It's not that simple. But, I'm certainly a real doctor. I've certainly written real papers. We had real results. As you said, some people had it done. And there is a number of people that we were extremely proud to be able to help. Military, non-military, active duty. Some of the SOF guys who were in the fight, last war, they believe they survived because they had, those procedures done, not just by me. There are other people who are done a beautiful job done. But the point is, if you can calm down the fight and flight nervous system, your life and the people around you will be much better.
Yeah. No, and I mean that, like, your passion for it, and just your ability, to just do more than just, specifically your job, your interest. It means a lot. And there's nothing wrong with folks that just go to work every day, do their job, come home,
No,
and they
of course
take it
not.
like that. That's fantastic. That's like the minimal standard, in my opinion. But it takes certain, it takes a percentage, of doctors like you who are taking it a step further and just being more creative and more innovative. And I just wanted to tell you on behalf of many that just I really appreciate, especially
Thank you.
your commitment to the veteran community. Thank you very much, sir. Closing
Thank you. It's an
remarks.
honor.
This is your opportunity, sir, to close us out. I always do like the senior enlisted E9 nudge to people and say, don't forget to thank your family, but you go ahead, sir. It's on you.
Well, I always thank my family. My wife definitely keeps me in appropriate path.
Yeah,
and
mine too.
And my son. But basically, what I would like people to, again, don't lose hope. There is real hope. There is real treatments out there. Number one. Number two, if you could fill out the survey, nobody makes money in it. You don't have to leave your. I mean, people are so jaded now. It's like, oh, they're gonna track me down. No, we're not trying to do anything of the kind. If you would like to read any of my medical publication and be bored, or if you know people who like medical publications, drugenelipov.com. You could see all the publications I've written. You could see when I was giving a speech in front of U.S. Congress. I gave a speech at MGH, which is part of Harvard. So you can kind of see the sciencey stuff. It may be too boring, but whatever. And again, if you'd like to pre-order the book, it's thegodshotbook.com. Short of that, I can only let people get him to water. I cannot make him drink.
There you go. There you go. Hey, my hope for tonight is just that, hey, if we can help just one person out there, get better,
It's worth it.
Then it's absolutely worth, the warm ups and and outlining this in our 30 minutes on camera. It's 100% worth it if we can help one person out there. So I thank you for your time. I know that you are an extremely busy man. For you to come on my small, humble podcast.
Oh, please.
I am just very gracious. Thank you. I'm going to ask you to hold on for a second. I'm going to collect your track and to everybody out there. Everybody, thank you so much for all your continued support. And hey, let's keep a good eye on each other and keep each other, inspired, motivated towards, higher goals. And if we see our brothers and our sisters that are veering, down that path of trauma to where, they're not in the right state of mind, please intervene and try to pick them up. That's all I got for tonight, man.